Hey, Dr. Lindsey and Wendy here. This is a quick video showing a great cleaning job by a lawyer, which almost never happens. And
and he was a redo, so it really, when the redos are so scared to do anything to
Right. So this guy had gotten a hair transplant a long time ago. It turns out he's related to one of my favorite teachers of all time. And he came and shopped with me in 2011 and then in 2015. And finally, we did him about 2 weeks ago.
I know, yeah. He said he finally had 1 week.
Yeah.
Yeah.
And so I always worry about people, as some of my videos show, about not cleaning correctly. And so this guy came the day after his surgery and got his head wrap off and went over with Wendy how we do it. And then he didn't want to come back. And like all lawyers, I figured he was doing nothing. And he came in on day 7, and that is awesome.
Yeah, he looks good, yeah.
Certainly the cleanest scalped lawyer we've had in 23 years. And so look at this little video. It talks about what he did. Okay, so here we are with Steve, who's 8 days out from, how many grafts do we do, Steve? Like 1900 or something like that?
Yes.
Up front. And Steve's a lawyer, which means they generally don't follow instructions. But look at this dude's cleaning. That is awesome. And he came, like we tell everybody to, and have Wendy go over with it with the patient how to do the cleaning. And what did you do? Again, I don't have your face on here. You don't have a real distinctive voice. Tell me, what did you do?
I did 20 minutes of conditioner twice a day. Shea butter on my head once.
What's shea butter?
Shea butter is
oh, that
oil.
stuff. Yeah, okay.
My goodness, Dr. Lindsey.
I shampooed twice a day, and I put on some oil. Rejuvenate, I think, is the name of it.
Well, the other kid that just left used baby oil, and that looked good as well. He did just as good a job. And you weren't too wimpy to rub on it like Wendy and I told you to, right?
I rubbed on it.
Good. All right. Well, I just wish everybody would clean. I never know anything's going to work, but if you clean like this, it's almost certainly going to work. Nurse, do you have any advice for these?
Well, just try it, if they ever book with us, plan on the 3rd day coming so we can teach you how to do it. Because at the beginning it's kind of scary to touch that thing.
Yeah.
But as long as you see and you know, then it's like, okay, right? It was a good guide to just know what.
Yeah, it was very important to have Wendy show me what to do.
Yeah, even though we got all these videos, nobody ever believes that you can touch it. And then you don't clean it, and then it doesn't turn out as good because you got a bunch of crap pulling out my hair. So, all right, thanks, Steve. So what do you think, Wendy? I mean, he followed the directions. That's all you got to do. After the 3rd day with our patients, you just got to clean, and you leave that conditioner on and put some oil, some baby oil works well, coconut oil.
Yeah. Surprisingly, like for a lot of our patients, when they're like in the waiting room and then somebody that walks in that had it done, they're coming for sutures on the 7th day, they look at them, it's like, you had a hair transplant? It's like, yeah. And when it's super clean, I mean, our patients been pretty good at cleaning now.
Yeah.
And when it looks super clean, it doesn't look on the 7th day, it looks like somebody just shaved your head really, really close.
Yeah.
It doesn't look like a hair transplant.
It's so, we had 2 rich guys in June, and neither one of them, they both lived within 2 miles of the office. We offered to see them daily, and neither one cleaned and neither one came. And they're just not going to get as good a result, and then, a year from now, my pictures won't be as good.
I know, cleaning is important, and, we come here Saturday, Sunday, whatever we need to do to make this work.
So if Wendy and I can help you, please give us a call. Thanks.